But for New Mexico, the key part of today's ruling may well turn out to be the one part of the health care overhaul that was overturned. The justices ruled that states cannot be forced to expand their Medicaid programs to cover everyone who cannot afford insurance. They left that up to each state to decide for itself. And there is already a dispute over whether New Mexico can and should. Katie Kim's been digging into that. Katie?
Dick, the question is, can we afford to expand Medicaid, or can we afford not to?
The fight brewing between state leaders will center around if Medicaid should cover another 170,000 needy New Mexicans, and if so, how to pay for that.
It's going to be very expensive.
Governor Susana Martinez claims New Mexico can't afford the estimated $83 million a year for 6 years that will be needed to expand Medicaid. New Mexico already pays close to $1 billion a year to insure the sick and poor.
When you grow that pool by that number and don't have the budget for it, you are sure to drain the funding that is available.
But supporters of expanding Medicaid claim it will actually save money. By their estimate, the average family that has insurance pays an extra $3,000 a year to cover those who don't. And there's this. A third of the patients treated at UNM Hospital last year had no health insurance. The bill for treating them was nearly $200 million.
We provide care regardless of the ability to pay.
So who covers that?
They're paying customers, and that's you and I.
Albuquerque Senator Dede Feldman says insured New Mexicans pay for it with those higher premiums and through taxes. Bernalillo County residents pay $90 million a year in property taxes for UNM Hospital. But if everyone had Medicaid or some other insurance, supporters claim that burden could be reduced. How much? It's hard to put an exact number on that.
And that's the crux of the problem. No one really knows what the numbers are. Will there be enough savings in one area to cover increased spending in others? We can probably expect endless arguments on that. Back to you.
All right, Katie, Governor Martinez did say there are some good parts of the health care law, in her opinion. She cited the provision that lets people 25 and younger stay on their parents' health insurance plan. And that affects about 26,000 New